Hello, my name is Ronald Calle, and I will talk about ezetimibe added to statin therapy after acute coronary syndromes. Statin therapy reduced low-density lipoprotein, LDL cholesterol levels, and the risk of cardiovascular events. But whether the addition of ezetimibe, a non-statin drug that reduces intestinal cholesterol absorption, can reduce the rate of cardiovascular events further is not known.
20 million Americans take statins, a class of drugs that protects against cholesterol buildup in the bloodstream. Now the FDA is requiring statin manufacturers to warn consumers about the drug's potential risk for cognitive problems and for elevated blood sugars that can lead to diabetes. Dr. David Dicek, a UW-Medicine cardiologist, discusses the issue.
Statins are commonly prescribed because they treat elevated LDL cholesterol, the bad cholesterol, which causes heart attacks. And in many studies, statin prescriptions has been shown to decrease cardiovascular mortality. It does currently seem as though these side effects affect only a small number of patients. Nevertheless, it's the FDA's job to put out these reports at an early stage so that people who are concerned about side effects can address them with their physicians. Well, first I would review what I saw as the risk-benefit relationship with the statin drug. Some patients are at particularly high risk for cardiovascular disease and derive a very high benefit from statin therapy, others less so. And also individual patients will vary in their tolerance for the side effects, a high glucose or a mild memory impairment. We might try to reduce the dose or even stop it if this was really unacceptable to the patient. But the patient would have to know that they were accepting an increased risk of heart disease by stopping the statin. I think the best approach is to contact one's physician and engage in a discussion of the risks and benefits of statin therapy. That will be an individualized decision, but it is optimally made with the guidance of a physician who knows your medical history well.
The use of 3-hydroxy-3-methylglutaryl coenzyme, a reductase inhibitor, statin, reduce both low-density lipoprotein, cholesterol levels, and the risk of cardiovascular events in patients with and those without cardiovascular disease. Intensive statin therapy, as compared with moderate dose statin therapy, incrementally lowers LDL cholesterol levels and rates of non-fatal cardiovascular events.
Hi, welcome to Straight Talk MD. I'm Dr. Brandy P. If you have high cholesterol, you're not alone. According to the Centers for Disease Control and Prevention, more than 35 million Americans have high LDL or bad cholesterol, which greatly increases the risk for heart disease and stroke. Many who have high cholesterol are prescribed medications called statins. But there are alternative ways to lower your cholesterol that, when combined successfully, may eliminate the need for statins altogether. Number one is exercise. You knew I was going to say that though, right? Exercise is key to helping your heart be healthy. But more specifically, research has shown that exercise can definitely impact cholesterol levels by helping to lower the bad cholesterol in the body. Number two is weight control. Being overweight increases the LDL or bad cholesterol in your blood. It is possible to be a normal weight and still have high cholesterol though, but this is generally due to a genetic predisposition that occurs in some people. Number three is really a biggie, and that's diet. Of course, just as important as what you're eating is what you're not. So steer clear of saturated fats found in fried and processed foods. To get those cholesterol numbers down and to keep your heart healthy, your best bet is to try a combination of the tactics that I just discussed. Remember that statins may be prescribed for reasons other than to just lower cholesterol. So, if you are currently taking these medications, please be sure to talk to your doctor before you stop taking any of your cholesterol medication. Also, talk to your doctor about any supplements you may be considering to lower your cholesterol in order to avoid potentially harmful interactions. Thank you so much for watching this segment of Straight Talk MD.
The risk of any myocardial infarction was significantly lower with simvastatin ezetimibe than with simvastatin monotherapy, as was the risk of ischemic stroke. There was a non-significantly higher risk of hemorrhagic stroke with simvastatin ezetimibe than with simvastatin monotherapy, although the number of hemorrhagic stroke was low.
Should you take a statin to lower your cholesterol? A new study in the New England Journal of Medicine found statins can lower your risk of heart attack or stroke, even if you don't have cardiovascular disease.
They gave patients a statin to lower their cholesterol, rosuvastatin, and they based it on their risk for heart attack over the next 10 years.
Mayo Clinic cardiologist Dr. Stephen Kopetsky says the study assessed risk in a new way.
We normally have things like blood pressure, we have things like diabetes, smoking.
This study also looked at waist-to-hip ratio, family history, slightly elevated blood sugars, and mild kidney dysfunction. Study participants were required to have a 10% risk of having a heart attack in 10 years, even though that risk doesn't seem very high.
The statin significantly lowered their risk of needing a bypass, a stent, having a stroke, having a heart attack, or dying over 5 years.
Dr. Kopetsky says lifestyle changes such as moving more and eating right are key to lowering your risk of cardiovascular disease, even if you do take a statin. For the Mayo Clinic News Network, I'm Vivian Williams.
In IMPROVE-IT, the addition to a statin therapy of a non-statin agent, ezetimibe, which reduced the absorption of cholesterol from the gastrointestinal tract, lowered LDL cholesterol by approximately 24%. The combination of simvastatin and ezetimibe also resulted in a significantly lower risk of cardiovascular events than that with a statin monotherapy, with a 2 percentage point lower rate of the primary composite endpoint of cardiovascular death, major coronary events, or non-fatal stroke. When added to statin therapy, ezetimibe resulted in an incremental lowering of LDL cholesterol level and improved cardiovascular outcomes. Moreover, lowering LDL cholesterol to levels below previous targets provides additional benefits.